it's really important that you engage a good healthcare professional team around you and make sure that they understand what it is that your goals are, make sure that they understand what it is that you want to attain long term, and help them to facilitate you reaching your goals.
It's often very worthwhile to set short-term goals with your physiotherapist. This may involve something as simple as being able to make it to the letterbox and back pain-free, or a more ambitious goal, like being able to finish the City to Surf at the end of the year. I find that with my patients, getting them to keep a logbook, an exercise diary, or any other form of measure can be particularly beneficial in maintaining your motivation. Even something as simple as carrying a pedometer, which measures the number of steps that you take when you're walking each day, can be a great motivator in order to try and reach short-term goals and eventual long-term goals. What gets measured gets done.
Sometimes it's hard to be motivated to exercise. Here are some things that can help you. So if you can talk to other people that have been through a similar experience and see that they've lost weight or they've improved their quality of life, that's a real motivating factor for you to know that you can do this. It's important as a motivating factor to give yourself rewards. So if you achieve your fitness and health goals, it might be to lose 5 kilos in 5 weeks. It's important to reward yourself and say, okay, I'm going to buy myself a new outfit, or I'm going to go and have a healthy lunch somewhere, or spend some time at the movies. So by giving yourself rewards and kind of self-affirmations that I have done this, that is a great way to keep yourself motivated. You can see where you're going, and you can see your goals that you set and where you're aiming, where you're headed.
With joint replacement, I think it's very important to have a goal. To say, I'm going to be up and walking pain-free in X number of weeks or months. Besides which, I was working full-time, so another goal was to get back to work. And with all my joint replacements, I've taken only about 3 weeks off work. Then I might have worked from home, but after 6 weeks, I was actually back in the office. Because I think keeping busy, mentally and physically active, is really the key to coping with pain and for coping with joint replacement. And the other thing is, I had a goal about what I wanted my knees to do. Because I worked at Premier in Cabinet, every so often I had to go over to the Premier's office, and he had this gorgeous furniture, but the seats were so low. And I'd get over there and I'd get into one of these seats, and then I just couldn't get up. So, well, not elegantly. So I said to the orthopaedic surgeon, what amount of flex do I need to get out of a low chair? And he said 140 degrees. So that was my goal. So after I stood up, about the next day after that, we started on physio. And my goal was to have that flex before I left hospital, in fact. And because I'd had both knees done, I would be lying on the bed doing the exercises, the cycling and all that sort of stuff, and then would get measured. And I was determined that they were both going to be the same. I mean, my left knee was more damaged. It took a little longer, but I still remember the day it reached the same level of movement as the right knee.